Good morning. Myself Stephen Bammal, and today we are going to see a topic called as electroconvulsive therapy. So, without delay, we will start with our topic. So, introduction. ECT, electroconvulsive therapy. ECT is the short form to be called for electroconvulsive therapy. It is the standard technique for inducing controlled therapeutic seizure in humans. It is safe and remarkably effective treatment that involves the application of an electrical stimulus to the scalp of a patient under general anesthesia and muscle relaxation. Now we are going to see history of abnormal behavior. So before moving to the ECT, we have to see how the people used to deal with those conditions where the patient used to behave abnormally. So in ancient times, as we are watching, abnormal behavior was said to be the cause of some kind of supernatural powers, for example, demons and monsters. Okay. So how they used to deal with those kind of conditions? For example, there is a patient who is not behaving properly. So there was one method. They used to think that those people are having abnormal behavior just because they are having demons or some kind of monster in them. So there was a method or there was a technique to take out those demons from the body, which they used to call this method as technique. Okay, so they used to think to deal with the supernatural power, you have to take help of something supernatural. So they included God in this therapy. So exorcism was one kind of thing they used to use, where a person used to pray to God in order to deliver that person from the demonic oppression which has been happening on that person's body or in that person. Next was trepanation. We will see with the image. Okay, so in this picture, you are seeing a father with a crucifixion in his hand, and he is performing exorcism on the person, thinking that the person is possessed with some kind of demons. And simultaneously, in this picture, it is called trepanation. So what is trepanation? Usually in the era of Roman time, they used to think if you want to take out some demon from a person's body, what they used to do, they used to dig a hole in his skull. This was called as trepanation. So what they used to do, they used to dig a hole in the skull, and they used to think if a demon has to be taken out from someone's body, this method is effective, so that the demon will leave the person's body through this hole. So now, why ECT was replaced by those kind of exorcism or trepanation or other techniques which were regarded as therapy? So Hippocrates was the first one to observe that malaria-induced seizure can be a cure for mental disorder. So what happened? There was a patient who was abnormal, who was mentally sick. So he was placed in a closed area where he cannot meet anyone, he cannot mingle in the society. So what happened? One day, there was one gill. So he just touched that gill, and the electric current was passed by that fish to that person, which produced some kind of seizure, and this thing was observed by Hippocrates. So what happened? When the patient got seizure, he was cured from his mental disorder. So Hippocrates thought that when seizures are produced, it can be a cure for mental disorder. So studying on that thing, ECT was introduced, ECT was invented. So before ECT, even there was insulin shock therapy also, and it was discovered by Manfred Scheckel in 1927. So what they used to do, they used to give bolus of insulin injection to the patient, which used to increase the sugar level of the patient, thus creating seizures in that patient, which used to lead to convulsions, and thus they used to say that this therapy will disorders. Next thing. Previously, what they used to do to control the patient. They used to threaten that patient for highly excited patient. So all the staff used to gather them, used to chain those patients, as you can see from that T. And they used to treat those kind of patients in this way. They even in some Asian times they used to beat those patients also. For there was one person also who has also, and there is also autobiography of that person written in scriptures, that the person was beaten for almost 1 year just because the society had admitted this patient, this person, in the dungeon area where he was beaten for almost 1 year in order to cure him from that mental disorder. Now, ECD origins in the 1930s. Okay. Serenity and Beanie were the first psychiatrists who used ECD in 1937. Work was going on ECD, but it was used in 1937. So definition. We have seen introductory part, now we are going to see definition. So electroconvulsive therapy is a physical therapy in which with the help of two electrodes, current is passed through the temporal region in between the two hemispheres of the brain to produce grand mal seizures. Techniques of ECT. Mostly there are two techniques of ECT. First one is direct ECT and the second one is modified ECT. So what we do in direct ECT, we are introducing ECT in absence of anesthesia and in absence of muscle relaxant drugs. Whether in modified ECT it is opposite to direct ECT, where drugs are induced such as muscle relaxants and anesthetic agent. So how much amount of current is passed in ECT? The passage of electric stimulus is almost 70 to 150 volts to the brain. For almost it is given for 0.1 to 1 second to produce grand mal seizure, which lasts for 25 to 30 seconds. Now what are the indications to whom ECT is given? First, major severe depression. In the patient who are having suicidal tendency, risk, that is self-harm tendency also, melancholia, stupor, severe catatonia and severe psychosis patient. All the conditions that comes under severe psychosis, they are given ECT. Now, what are the contraindications to whom ECT is not given? So first, whose intracranial pressure is high, that comes under the absolute one. Then the relative part, in that conditions like MI, severe hypertension, cerebrovascular accidents, severe pulmonary disease, retinal detachment and phenochromoscytoma. These are the conditions in which ECT is contraindicated. Now what are the side effects of ECT? Mainly there are two side effects of ECT. I have given headings like physical effects and medical effects. Now what comes under physical effects? Such as muscle cramps, muscle spasm, or jaw dislocation, or say joint dislocation. Because at the time of ECD, the patient gets convulsions, which can produce some kind of dislocation in that patient, because he stretches his body at a certain amount where the patient cannot bear those stretching. Now what comes under medical side effects are confusion, loss of appetite, nausea, then in some conditions the patient feels weakness also, that is generalized weakness, fatigue. Those are the things that come under medical side effects. Now we are going to see what are the role of nurse before ECT. So first point, check that thorough physical examination is done, like blood sugar level, HB level, even urine analysis for checking the sugar level in the urine. We have to first take the written consent of the patient also. Then the patient should be given nothing orally before the treatment. to prevent vomiting and even aspiration. Then we have to remove all the metallic articles from the body of the patient, for example ring or chain. Then removing artificial denture if the person is having, to prevent some kind of dislodging and blocking respiratory system. Removing lipstick and nail polish, this comes to the female patients. Then encouraging the patient to empty bladder and bowel. Discourage cigarette smoking before ECT to avoid difficulty in managing pulmonary secretion during ECT. And next, we have to monitor the vital signs before sending the patient for the ECT. And there are some pre-medications that are given you for this treatment, that are injection atropine 1 mg just before ECT to decrease oropharyngeal secretion and to block the vagus nerve for protecting heart from bradycardia and arrhythmias. Now what are the role of nerves during ECT? Now we have seen before ECT, now we are going to see during ECT. So patient will be transferred from waiting room to the ECT room. Place patient in supine position. Administer injection sodium pentothal, that is about 1 mg, which is an anesthetic agent, and injection succinylcholine 1 mg, which is muscle relaxant. Then the mouth gag is placed between the patient's teeth. So we have to support the shoulder and arm lightly by restraining thighs with the help of a sheet. To prevent jaw location, hyperextension of the head with support to the chin is given. We have to give O2 if necessary. O2 should be given before and after muscle relaxation induced apnea, as the oxygen demands increases during seizure and even reduces the seizure threshold. We have to provide electro dip in saline water or jelly for placing on the temporal region, as it is a good conductor of electricity. And we have to make observation for granular seizure which last for about 25 to 30 seconds. Do suction immediately and restore respiration to O2 mask. Now what is the role of nurse after ECT? We have seen before ECT, we have seen during ECT, now we are going to see after ECT. Client must be shifted to post-procedure room after the procedure. We have to check the vital sign for every 15 minutes until the patient condition stabilizes. Then if the patient becomes aggressive, confused, which are the side effects of ECT, we have to administer injection paralyte of about 50 to 100 mg of chlorpromazine or diazepam, that is for 5 to 10 mg IV. And it also depends on the doctor's order. Then use of side rails to prevent fall of the patient. Reorient after recovery of the client. We have to reorient the patient. Then any relative findings, whether the patient is having any kind of abnormal finding after the ECT, that has to be documented. So this was the role of a nurse during ECT, before ECT and after ECT. Now the topic which I have taken this topic from the book Aujanigal, the short textbook of psychiatry, 20th edition, JP publication, page number 211 to 216. Next book which I have referred, that is KP Nirvana, Essential of Mental Health and Psychiatry Nursing, volume 1, JP publication, page number 224 to 227. Thank you.